Today, we're joined by Quincy Brown. Dr. Brown is a biomedical engineer whose career has been focused on the development and translation of light-based sensing and imaging technologies in medicine. As the director of Translational Biophotonics Laboratory at Tulane, major themes in his current research are the use of novel imaging devices and computational analysis tools to improve patient outcomes in surgical tumor removal in organs where positive surgical margins are a factor affecting patient comorbidity and prognosis. Rapid screening of biopsies at the bedside for maximizing biospecimen quality for diagnosis and personalized medicine, and new technologies and applications for human-machine interaction in real-time hybrid analog digital pathology. He and his team were selected as an awardee of the Advanced Research Projects Agency for Health Precision Surgical Interventions Program. The project, called MAGIC-SCAN, is seeking to develop an end-to-end human plus AI collaborative rapid microscopic scanner for comprehensive pathologic imaging of resected tumors in the operating room. Today, Dr. Brown will describe the MAGIC-SCAN project, which aims to develop an end-to-end imaging and AI solution to comprehensively detect cancer-positive margins in the operating room in 10 minutes.
Hey, I'm Quincy.
Hey, how are you doing?
Good. How are you?
Good. Glad to have you on.
Yeah, thanks. My pleasure. Yeah, thanks for having me. Yeah.
Absolutely. What is the overall goal of the MAGIC-SCAN project? Kind of talk about the goals and what it is in general. It's very interesting.
Okay. Yeah. Yeah. Great. Thanks. Thanks for having me. I really appreciate being here. So the Magic Scan project is the project that we're leading at Tulane in association with University of Georgia, University of Utah, Instapath, Cedars-Sinai, New Orleans VA, East Jefferson General Hospital, and it's part of the ARPA-H Precision Surgical Interventions Program, which is really geared around making cancer surgeries one and done, right? That's kind of the goal of the project is how do we ensure that surgeons are able to know when they've removed a tumor completely. And so with early detection, it gives us the opportunity to do, to remove a cancer before it becomes metastatic. But in order to do that, we need good surgery. And so, there's, been a long history of different ways of trying to get intraoperative determination of whether a tumor has been completely removed, but those have all had limitations. And so what the goal of this project is to basically develop a microscopic scanner and an AI algorithm and all of the technology associated with that can scan a tumor in real time in the operating room and give an answer about if there's cancer on the edge of the specimen and where in 10 minutes. And so if you're familiar with Mohs surgery, so for Mohs, for skin cancer, they sort of do this layer by layer thing. In Mohs, they can send you to the waiting room. But if you're doing a colorectal surgery or a prostate surgery or breast surgery, they can't do that. And so really it's about that. So developing the technology to image and give an answer in 10 minutes.
Wow, that's
With the
incredible.
goal of course, telling the surgeon, here's where you need to go back and take more tissue during that first surgery.
So is this being used or is it sort of beta? Is it yeah, can I tell where are we at with this technology?
Yeah, yeah. So the original prototypes we developed here at Tulane in 2013, I think, and so we actually did a number of clinical studies using that device. We did about 200 patients in prostates, 60 patients in kidney, I think. We've done a lot of stuff in breast. And what we've proven is that it's feasible. So we can, and this again, this what we're imaging is the fresh tissue. So we're not doing, if you're familiar with pathology, I know many of your listeners will be,
Yeah.
you're sending the tissue to a lab and you're getting, histology a week later. We're not doing any of that. We're not cutting the tissue. We're just imaging the tissue directly in its fresh state. And so we've proven that that's feasible. But the issue is that it's taken too long in the past. And so it would take us maybe an hour to get the answer that we need. And so what we're trying to do in this project is to speed it up dramatically. And so going from an hour to 10 minutes may not seem like a big deal, but it's actually when we were already going as fast as we thought we could go before. And so really it's supercharging the technology to really make this a possibility.
Yeah, so you're moving the lab results Way up.
to the patient. Yeah, we want to go from, again, move all of that in space and in time from the lab to the patient's bedside. So,
So what are the requirements for it to be a successful project? What are the project successes?
right. So basically, cancer is a microscopic sort of issue, right? So the pathologists, they're looking at tissues under a microscope. So what we've been tasked to do is to identify if it exists a single cancer cell. So we need resolution we need to be able to see things small enough to see a single cancer cell over something about the size of a regular piece of paper. Okay, so 600 square centimeters, so about the size of a piece of paper. Again, that may not seem like a big deal, but we're talking about maybe 1 trillion pixels, right? So your iPhone maybe has 14 million pixels, something like that.
Yeah.
We're talking about 1 trillion that we have to gather in 10 minutes, and then not only that, but these images. They're like Google Maps, right? They're huge. And so it's like you could think of like geospatial, like satellite imagery. It's probably too much data for a human to
Yeah.
really go through in that amount of time. And so the AI, the computational algorithms also have to go through that amount of data. So that's what we're tasked with. So we're tasked with detect a single cancer cell, if it exists on the surface of the XI specimen, detect it, show its location to the surgeon within 10 minutes, and be able to do it in a rural hospital at the end of 10 years, at the end of 5 years.
Oh, that's great.
So, and we have to do that. So we have to deliver this to 2 rural hospitals at the end of the project. So it can't cost $1 million.
Yeah.
It can't require the fastest internet you ever heard of. It really needs to be something that's practical for every American.
So the device would be sort of like a scanner, essentially.
It's a scanner. Yeah, you can sort of think of it as like a document scanner, but for tissue.
So it scans the tissue and tells you if there's a single cell.
Yeah, that's the goal.
Yeah.
So,
And at a price point. So yeah, plus you have an AI component. Um,
mhm.
so accessing that algorithm, would this be a web-based scanner so that the algorithm would be, referencing an algorithm over the web, or would it be standalone software in a clinic? Is
Yeah,
any thoughts about how that's going to be, how that
yeah.
be?
That's a great question. It kind of gets to the heart of the issue. So when we talk about sort of deployment to rural areas, so I'm from a small town in North Louisiana, and so um, my parents have a satellite internet. It's pretty good, but it's I've got fiber here in New Orleans, and so mine's a lot better. And so really, you think about internet, even something that simple. That's going to maybe determine whether or not you can use that web-based approach, or whether you have to have something sitting inside the hospital or the
Yeah.
clinic. And so I think that's where really a lot of the conversation needs to be had around deployment of AI technologies in rural areas, or areas where the infrastructure might not be there. And that's a great opportunity for us as technologists, right? So we can kind of come in and try to help, bridge solutions to those problems. But so it's
Yeah.
a good question. We don't really know yet.
Yeah, yeah. Well, my background's information technology. I'm not a
Uh,
physician, but understanding, sort of a cloud-based solution where the algorithm sits somewhere, it can
mhm,
be modified and updated and evaluated
mhm,
because it's cloud-based, and then of course it's just internet connection. And I think it just comes back to the thing with all AI, which is, the computing horsepower not done locally, but done through
right,
internet. So I would imagine
right.
that architecture would be consistent with a lot of the other AI things we're seeing. Seems like the scanner. I know that scanning technology's come a long way as far as being able to capture pixels. Uh, so, any idea on, where you are with that part of it, the hardware, the scanning component of it, as far as cost and the quality of the scanners being cost affordable, cost effective?
Yeah, we've actually made a quite a we really have thought about this always from the very beginning of the project. So um, we could have chosen. So what we're doing is, rather than physically cutting the tissue, which is what takes so long in the histology process, is that you take this fresh tissue and put it in formaldehyde. And that takes a day, and then you embed it in wax, and that takes a day, and then you cut it and put it on a slide. Right, so this takes time.
Yeah.
Rather than physically cutting it, we're optically cutting it. So we're using light to cut the tissue. And so One of the most common ways of doing that is a confocal microscope. And so a lot of research labs, even hospitals, will have maybe one confocal microscope that's used for research. And that's a way of basically isolating light from a single plane of the tissue. Those are great, work very well, but they're expensive. They have these moving parts that are expensive, and they're slow in comparison to the types of things that we're developing. So we really thought about this from the very beginning, and so the technology that we chose to develop um, tries to get around that in terms of complexity, so that it can be less expensive. And so, uh, you know, it's too early to say what it's going to cost, what the final version is going to cost right now. But
Yeah.
I can say that it's definitely based on what the work that we've done and people that we've talked to. We think it would be within the realm of possibility for hospitals to be able to purchase a couple of these. Even so it's above the limit. So you're still going to be talking to your value add committee in a hospital purchasing, but it's not as much as maybe like these other types of microscopes. And so we're putting a lot of thought into it.
Yeah. Similarly, it's been a while, but point of care ultrasound is sort of the same kind of thing where
Hmm.
the technology has gotten accessible to more people, and what you can do, at point of care, and what you can discover and learn at point of care, and how you're moving that timeline up, and actually being able to see things that, maybe people would never even get to. It sort of sounds like it might be sort of on that similar trajectory where you're trying to
Yeah.
figure out how to get these types of devices or this type of equipment in. Um, so this is really exciting.
And I also just point out, I think a lot of that comes from just the advancements that are happening across the board in terms of manufacturing and the technology. So we're living in a great time right now where all these amazing technologies are being developed. Everything's accelerating very quickly. And so it's like the right time for this kind of advance, because we have all of this wealth of new technologies that we can say, oh yeah, now there's a new part that's being made that really makes something faster or less expensive or whatever. So yeah.
So what do you foresee sort of like a timeline if you were to project out how far off are you, do you think?
The way the program is structured, by the end of so we're a year in. By the end of next year, we have to deliver a system, and so they're going to run it through its paces. So we really anticipate that in the next year, at least, we won't maybe have done all of it, but for the riskiest parts of the challenge, we will have met it. And then beyond that, we have a timeline for 5 years.
Yeah.
Obviously, moving things, out into the market, is there's a lot of things that depends on. But I think that the technology will be where it needs to be. And so I think a lot of the other things, especially when we're talking about AI and some of these other things, certainly policy and regulation, those things will come to play. Trust, all the things that you talked about, like
Yeah.
where does the data live, data privacy, all these things we're going to run into. But what's great about this project is in this program, really ARPA-H, is that they're really accelerating these things. And so involved FDA. They have involved NIST and these other government agencies to break down the barriers so that they can translate things as quickly as possible. So
And I think that, we have seen other technologies that now there's frameworks now for a lot of those types of things, the regulation.
yes,
Mm.
yeah. So as soon as you get one success, makes the people that come behind them, it's a lot easier. So we're
Exactly. Yeah.
hoping to we're hoping to build on that. Yeah.
Yeah, absolutely. Anything else you'd like to close with?
No, I just want to say I'm excited about the meeting this fall. I'm like, really excited to share what we're doing and to hear from folks. I uh, uh, feel very strongly that as an engineer and as a designer, we really work for you. We work for the physicians, and so we start with your problems and your pain points, and we work backwards and try to find good solutions. So I'm really looking forward to maybe learning more, getting some feedback on what we're doing, and then maybe there's some new problems that we could work on that would be fun to work on. So I'm really
Uh,
looking forward to it.
Yeah, absolutely. Very, very thankful to have you at our meeting this year, and to hearing your full presentation. And thank you for joining us today and sharing. And yeah, let's make a commitment to stay in touch and kind of see how this progresses.
Absolutely, Randy. I appreciate it. Thanks.
Thank you,
Great to be
Dr.
here.
Brown, very much. Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.